I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today is electromagnetic frequency, EMFs. You may have seen that initial EMF. What is an EMF? Electromagnetic frequency are these low frequency waves that are surrounding us. They come from things like your cell phone. They come from Wi-Fi. They come from the earth, microwave ovens. And these electromagnetic frequencies, when they get into the body, can actually have an adverse effect on your health. Now, at the break, my producer and my cameraman said, slow down. That was a lot of complicated stuff you just talked about. Slow it down a little bit. And I said, okay, I will. You're absolutely right. So I want to go over that a little bit again because I don't want to lose anybody. I know I use a lot of big words there. So what happens is electromagnetic frequencies, these waves, when they go to a cell, they affect the membrane of the cell. Now, on the membrane, you have a bunch of different receptor sites where things are absorbed. You can have a vitamin D receptor site. You can have a nutrient receptor site. And you have calcium receptor sites. And so what happens is the calcium receptor site opens up and lets a little calcium into the cell, and that's perfectly normal, and that's great. But when you have electromagnetic frequencies, what they do is they open up those calcium channels and dump massive amounts of calcium into the cell. And when that occurs, the cell starts to react. And over a series of steps, and that's where I got a little confusing there, over a series of chemical steps, it creates something called free radicals. Now, free radicals are like Pac-Man, or they're acid. They eat through things. And so these free radicals can get into your cell and attack what's called the DNA. Now, the DNA is the part of the cell that makes you, you. Everybody's DNA is a little different. And so when it starts attacking the DNA, it changes the DNA. Why is that important? Well, that DNA is how the cell replicates itself and makes more cells, more of you cells. And when it doesn't produce normal you cells, it can create abnormal cells. And DNA damage can lead to things like cancer, abnormal cell reproduction, cell malfunction. Pretty serious stuff. So the waves don't directly cause damage. They indirectly cause damage by allowing the calcium channels to open up and dump the calcium in there. And that's a big issue. Now, as a chiropractor, my team of doctors and I are very concerned about your nervous system. And the nervous system is very, very sensitive to these electromagnetic frequencies. So they open up the calcium, dump the calcium in, and alter the nerve cell function. And the nerves control everything. The way the body works is your brain sends messages down your spine, out your nerves to every cell in the body. So there's a nerve that goes to your heart, which we're going to talk about next. Your lungs, your spleen, your kidneys, your prostate gland, everything is hardwired to the brain. And the electrical impulses have to travel along those nerves from the brain to the body and back up to the brain. So if you have interference, chemical interference in this case, it can cause problems. Two things can interfere with the nerve impulses, chemical or physical. The electromagnetic frequencies now affect a chemical reaction, which affects nerve function. So it's pretty serious stuff, and it's really cool. When I do live lectures, I do this in a lot of my live lectures. I'll have somebody come up. I usually pick the biggest, brawniest person in the audience, and I'll bring them up on stage, and I'll put their arm out and push against their arm, and they'll be strong. Then I have them take their cell phone and hold it against their chest, and I push again. And when I do that, 100% of the time, no matter how big or strong this person is, the muscles go weak. And that just shows you how potent these electromagnetic frequencies are and how they affect the nervous system. Every time I do it, 100% of the time, people now take their cell phones out of their pockets and put them on the floor. They put them in their purse. Everyone realizes that this is a serious thing when I can physically show you what's going on. So it's really important that you consider this, that it's having an effect on your body. It has to have an effect on your body. Some people are more sensitive than others, but it is having an effect. It's like eating a bad diet. I have a friend of mine, he drinks a lot. He says, well, I don't care. Doesn't matter to me. And he says, I'm okay so far. He gets his blood work done. I'm fine. It's doing damage. Then suddenly he comes to me one day, almost in tears, about my age. And he says, my cholesterol's up. My liver enzymes are up. What do I do? And I look at him, I said, what do you think I'm going to tell you to do? He said, you're going to tell me to quit drinking, aren't you? I said, yeah, you need to quit drinking because alcohol destroys the liver. And then he did it. and his blood went back to normal again. So the damage was happening. He didn't see it happen until he had his blood work done. The damage is happening from these electromagnetic frequencies. Everybody is affected by it, some people more than others. And the nervous system, of course, controlling everything is a major concern of mine. Because if the nervous system isn't working, you're not working. So I teased a little bit before about the heart. Your heart is also very sensitive to electromagnetic frequencies, particularly the pacemaker cells of your heart. They have the highest density of calcium absorption sites. Now, you need to know electromagnetic frequency exposure can be a major contributing factor, and I want you to take immediate and aggressive steps to solve this problem, to stop your exposure. Cardiac arrhythmias, atrial fibrillation, atrial flutter, premature atrial contractions, premature ventricular contractions. This is when the heart's beating irregularly. Also known as heart palpitations, tachycardia, which is fast heart rate, brachycardia, slow heart rate. A third area with densely populated calcium absorption sites is the reproductive system. So the heart is going to be affected by it. It has to be. Sometimes we're okay with it. Sometimes we're not. So from a chiropractic standpoint, we check the nervous system because the nervous system controls everything. We want to make sure you don't have pinched nerves. We check the muscle system, make sure you're balanced muscularly. If you have degenerated disc, that means the bones are out of place rubbing up against each other. So if something's out of place wearing out, what's the most logical thing to do? Put it back in place. That's where chiropractic comes in with osteoarthritis. Osteoarthritis is always mechanical. So we can do the physical work. If you have acid reflux, heartburn, burping, gas, bloating, we can actually adjust the stomach or pull the stomach down away from the diaphragm. Amazing results when you work on somebody's digestive system. It's so exciting to fix people. And I had this problem for years. That's why I'm excited to tell you how easy it is to fix in most cases. Then we do the nutritional. We make sure you're taking things like Dr. Joe's Super Greens, Dr. Joe's Essential Source. If we can do B vitamins. B vitamins are very important for the nervous system. Adrenal support. If you're older, if you have stress, if you're drink stimulants like coffee, you have bags under your eyes. These are signs of adrenal insufficiency. I might recommend Dr. Joe's adrenal support. So we do all that for you. Now you have to help us a little bit. I really want you to consider electromagnetic frequency as a really serious concern. And if we have time, I'm going to talk about the new system that's coming out. We have 4G, now we're coming to 5G. And people like me are very, very worried about the electromagnetic frequencies going to be put off by 5G. And in fact, if I don't get to cover it, I want to cover it now. Belgium has actually stopped the installation of 5G, and several other countries around Europe are considering it or done it as well, because the electromagnetic frequencies are higher than the allowable standards. So usually Europe is smarter than us when it comes to healthcare. This might be something we want to consider. It's probably going to happen, but I really want you to do everything you can to keep yourself healthy so you're not being attacked by these electromagnetic frequencies. The nervous system is affected by it. The heart is affected by it. How about your reproductive system? Particularly the male testicles. A consequence is impaired and reduced fertility. There's even evidence showing that electromagnetic frequencies can cause both male and female infertility, but male infertility has been one most studied. Studies have linked low-level electromagnetic frequency exposure from cell phones to 8% reduction in sperm motility and 9% reduction in sperm viability. So this is something we didn't have to worry about years ago. I've been in practice a long time. And patients every now and then come to me and say, Doc, we can't get pregnant. Okay. So chiropractic care many times would help that, open up the nerve supply in the low back to the reproductive organs. We get them on a good diet, get them healthy, get them on some supplements to stimulate the hormone production, things like Dr. Joe's adrenal support. And in most cases, we got good results. Now we're seeing this all the time in our practice. Men and women coming in saying, it's him, it's her, we can't get pregnant, what's going on? So now we have to look at other things. Wi-Fi equipped laptop computers have been linked to decreased sperm mobility. Gentlemen and ladies, how many of you sit with your laptop on your lap? That's why it's called a laptop, right? And if you're on Wi-Fi, you're sending these electromagnetic frequencies into the reproductive organs, the testicles and the ovaries. And an increase in sperm DNA fragmentation occurs. It breaks up the DNA after just 4 hours of use. How many of you have used your computer for more than 4 hours in a lifetime? Pretty serious. Women, you carry your cell phone in your bra, for example. You can risk a cancer in the upper inner quadrant of the breast. Now, they say, well, no, it can't be doing it. This is a very atypical and not usual to have in the upper outer quadrant. But when you put the phone in there, it's usually the side where you carry the phone. Brain cancer, another possibility from extended cell phone use if you keep the phone next to your ear. How many of you have ever read the little packet, the little instruction guide that came with your phone? It's really small. My friend Clark Howard calls it mice type, like a mouse type that it's so small. Anybody ever read that? In there, it says, do not put the phone next to your head. What do you do with your phone? You put it next to your head. Of course we do. You want to hold it an inch or two away from your ear because the electromagnetic frequencies decrease dramatically even just an inch or two away. So with your phone, I'm going to talk about this in a second too. Wired headsets. I have wired headsets or speakerphone. Now, if you're in a state where it's hands-free driving, good, I like that. Put on your speakerphone if you have to talk to somebody. Roll up your windows and talk on speakerphone or use a wired headset. I have a wired headset in my car and a wired headset in my house. So if my phone rings anywhere I am, I got it. Okay, and in the office, I don't usually use my cell phone because I'm seeing patients. Most people use cell phones, and those who develop brain cancer are pretty few and far between. So let me back up and say, don't have to get too concerned about this, but you don't know if you're going to be the person until it's too late. The problem is brain cancer has a latency period of over a decade or more. So you're saying a lot of people use cell phones, very few people have brain cancer, so what? In a year, it's 10 years from now, I don't want to put this on the Dr. Joe is right column. And here's the thing with this. Let's assume I'm wrong. So what? I'm wrong. I lied to you. So you used a headset. So you used a speakerphone. So you didn't hold the phone next to your ear. So you shut off your Wi-Fi at night. So you didn't carry your cell phone next to your crotch. So what? There's no downside to heeding these warnings. Because most of the things we talk about, I've been lecturing now for 35 years, most of the things we talk about come true. In fact, my mother one time said she's not sure if I'm a prophet or a nut because I talk about these things and then 5-10 years later, oh, it's common knowledge. Everyone knows that now. Well, I want you, my listeners, to be way ahead of the curve. I like you guys. I want to keep you around for a long time. I want to keep my listeners listening. So, industry, the wireless industry says there's not enough energy from microwave radiation to cause direct damage to what's called the covalent bonds of the DNA. Absolutely true. We talked about that in the first segment. It's a biological amplification resulting in excessive oxidative stress that causes the damage. The cells open up, they allow calcium in, there's the oxidative stress. Most of the damage caused by ionizing radiation is due to secondary free radical formation that breaks down the DNA. So again, I take a cell phone, put it next to a cell in a petri dish in a laboratory, I don't see a whole lot of change. However, over time, the calcium channels opening up can cause the problems. So it's not directly from the energy within the radiation. Now, naturally, to reduce your risk of harm, you need to reduce your exposure to electromagnetic frequencies. Cell phone towers should be a major concern if you work or go to school within 300 meters. That's 1,000 feet. Okay? 1,000 feet is what? 3 football fields maybe? A little over 3 football fields? So if you're that close to one, you might want to consider changing your location. I actually had a friend of mine, and she was looking at a house, and she fell in love with this one townhouse, and she looked, and there were 3 cell phone towers around the house. And she said, I'm not willing to take that risk. So what's going to happen with 5G is cell phone towers most likely are going to become a thing of the past. You think that's a good thing? Well, what they're going to do is they're going to put these boxes on buildings instead of cell phone towers. And that becomes a real big issue because now it could be right next to your office. Driving around can expose you to substantial cell phone tower radiation. If your cell phone is a major source of exposure, so are cordless phones, Wi-Fi routers, wireless headsets, and other wireless items, including wireless mice or mouses. I don't know what the plural of mice is at your office. Keyboards, smart thermostats, baby monitors, smart meters, and the microwave in your kitchen. So if you have to use something, I recommend you try to get something that's wired if you can. When I'm in my office is built into my one office in Marietta is built into the side of a hill. So when I'm way back in my office, way in the back, couldn't be a better place. We don't get cell phone reception. Awesome. Love that. And then I have a wired phone that I talk to you. If I'm on my cell phone, I'm using a cord. So again, as your doctor, and I want to be your doctor, I want to help get you well and keep you well. So we got to get the nervous system working physically. From a chiropractic standpoint, we can give you chiropractic adjustments. And in most cases, that's amazing. It helps reduce pain. It opens up nerve supply. It opens up blood supply. It stops the discs from wearing out. Helps balance out the musculature, opens up the nerves to the organs. Chiropractic care is just amazing. And every day patients say, why doesn't the whole world just do this? It's quick, it's easy, it's inexpensive, it's very effective. I don't know why the whole world, but hopefully you'll listen and come see us. But the nervous system we can fix physically. You've got to fix the electromagnetic work. And then you got to make sure you have enough antioxidants to fight the free radicals. So if you want to make an appointment to come see us, if you have neck pain, back pain, shoulder pain, numbness, tingling, ever been in a car accident, how about this? You're tired of suffering? If you're sick and tired of being sick and tired, go to my website right now, drjoe.com, make an appointment. We want to be your doctors. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. And I know this show goes all over the world. So if you're not capable of coming to see us, a lot of people travel to see us from all over the world, which is great. We can always do a phone consultation to do a nutritional analysis with you. We can do that over the phone. So the website, 24 hours a day, 7 days a week, drjoe.com. You can also order the supplements we talk about there, send questions through the website. We want to help get you well and keep you well. And we have over 1,000 hours of audio and video podcasts there as well. Go to the media link, and where it says SoundCloud, those are audios, and we go way back on those. And then where it says YouTube, we have the videos as well. So whether you're auditory learner, visual learner, it's all there for you. So what we want to do is ideally address each source and determine how much you can best limit your source of electromagnetic frequency exposure. Simple remedy. We talked about turn off your Wi-Fi at night. It's not necessary exposure. You're sleeping anyway. Don't carry your cell phone on your body. If you're working out, you like to carry your cell phone, the place I want you to put it is on an armband on your right arm, far away from your heart. So if you have to carry your cell phone, armband, right side of the body, or carry it in your hand is fine too. And then you can have a wired headset. If you're doing something you can carry in your hand, and have a wired headset if you have to listen to music, or better yet, you can listen to Dr. Joe's podcasts. A lot of people listen to the podcast when they're working out and say, Doc, it motivates me way better than any music because you get me excited. So you can do that as well. But please keep it as far away from your genitals and your heart as possible. The place on the body would be your arm. Now, if you have a wrist band, I guess you could wear it on your ankle as well. That would work too. So don't use your laptop directly on your lap. These are just some simple measures. You can get cell phone pouches that are shielded on one side. So put that side towards your body. It gives you some protection. Use your cell phone with a headset or a speakerphone. Work toward hardwiring devices so you don't have to be in the Wi-Fi field. Don't get unnecessary radiation from cordless mice, keyboards, printers. Also possible, if you're in a house or an apartment, you can lower your exposures every way you can because especially in an apartment, you have no say in what the neighbors are doing. You have a better idea of how to remediate these problems by listening to shows like this. Now, in this case, since we know the effects of electromagnetic frequencies are reduced by calcium channel blockers, a natural solution would be to get enough magnesium, which is a natural calcium channel blocker. Most people are deficient in magnesium. In fact, when I talk about nutrients that people are deficient in, magnesium, vitamin D, omega-3 fatty acids, most people are deficient in that. That's why I recommend Dr. Joe's Super Greens and Dr. Joe's Essential Source. It's a great starting point. It's not the end-all be-all, but it's the great starting point. You can mix it with coconut water, coconut milk, almond milk. They have 2 powders. I take a scoop of each. Some people like to mix it with a frozen banana, some frozen berries, make it a smoothie. Depends what you like and what flavors you like. I've already done it where I eat oatmeal a lot. Organic, old-fashioned oats, and I'll just pour coconut milk over it, some raisins, and I'll eat it cold. You can add the Super Greens, the Essential Source to that if you want to. Just get it in your body. That's the most important thing. But back to the magnesium issue. If you don't have enough magnesium, it's going to worsen the impact of electromagnetic frequencies. Again, this Dr. Pale. It's clear that when you're deficient in magnesium, you get excessive calcium activity or the EMF activities. One approach to dealing with these things is called nuclear factor erythroid 2. It's NRF2. So let's talk a little bit about NRF2. There are a few things it does. It lowers inflammation. It improves mitochondrial function. It stimulates mitochondrial biogenesis. What is a mitochondria? It's the part of the cell that generates energy. Okay, it's the powerhouse of the cell. Everybody ever studied medicine or health know about the powerhouse of the cell. It helps detoxify the body of foreign bacteria, carbon-containing toxins that can be detoxified, heavy metals. So this chemical is very important to get the body functioning normally. It activates the transcription of over 500 genes in the human body, most of which are cytoprotective functions. They protect the cells. So this includes 3 genes that encode enzymes required for the synthesis and produce glutathione. Glutathione is a major antioxidant. Antioxidants do what? They fight free radicals. It's one of the most important antioxidants in the body. A simple way to activate this NRF2 is to consume NRF2 boosting food compounds. What can I eat to produce this? Cruciferous vegetables, things like broccoli, Brussels sprouts, cabbage. It's called cruciferous because when the flower forms on the vine, it's in the shape of a crucifix. That's why it's called cruciferous. Absolutely useless information there. Long-chain omega-3 fatty acids, DHA and EPA. I get mine from algae oil because it's the purest form of DHA and EPA. Carotenoids, sulfur compounds from what's called alum vegetables, isothiocyanates from the cabbage group. Garlic is good for this. Onion is good for this. So eating, once again, what do we say? Vegetables are going to give you the nutrients that you need to produce the NRF2, which is going to help protect your cells. Why not take Super Greens, an essential source every day? Great source of antioxidants. Exercise, calorie restriction is going to help the body work real well. In the past, I've talked about intermittent fasting. What I want you to do is I want you to skip dinner or breakfast 2 days a week. And every time you eat, it takes 8 hours for your body to metabolize that food. When you skip a meal, you give the body a whole 8 hours of rest. And that's when the cells can regenerate. Activating the nitric oxide pathway. One way of doing this is do what's called dumping exercises, where you work out really, really hard for about a minute or two, and then you rest. That's also going to raise your NRF2. So peak 8, we called it. Work as hard as you can for 30 seconds, rest for 2 minutes. As hard as you can for 30 seconds, rest for 2 minutes. Now don't rest, just stay in motion. But if you're jogging, lifting weights, whatever you want to do, 30 seconds of hard work. Now, if you're just starting to do this, chances are you're not going to be able to go 30 seconds as hard as you can. You may go 10 seconds, 20 seconds, 30 seconds. This is still a great way to increase your nitric oxide production, which can help. And also Dr. Joe's nitric oxide support. So the take-home message, I personally believe, is that electromagnetic frequency exposure can be one of the most significant factors. And it's so easy to fix. It can decrease sperm count in men. It can increase the prevalence of anxiety, depression, autism, Alzheimer's. It's also highly likely to contribute to cancer. So electromagnetic fields are all around us. None of us are free from it. It's everywhere these days, especially with Wi-Fi. They emanate from power lines, televisions, household electrical wiring, appliances, microwaves. Please, folks, if you have a microwave, don't use it. And if you do use it, I don't think you should. But if you do, set it and walk away as far away as you can. Then you have the information and carrying radio waves, cell phones, cell phone towers. They're everywhere. A host of other wireless gadgets. And these phones where you just have the wireless thing going right up to your ear, not a big fan of those at all. So let's talk about some of the symptoms you might have. And symptoms may vary from individual to an individual. Some of the issues that you may be having are most commonly reported symptoms of electromagnetic frequency are skin rashes, flushing, burning, tingling, confusion, poor concentration, memory loss, fatigue, muscle weakness, headaches, chest pain, heart problems. Other reported symptoms include ear pain, panic attacks, seizures, tinnitus, which is ringing in the ears, feeling vibrations all over your body, unrelenting dizziness. Electromagnetic hypersensitivity syndrome is actually a thing. Sufferers that have this have a gene that inhibits the body from detoxifying. Other at-risk groups for developing electromagnetic frequency problems are people with spinal cord damage, whiplash, concussion. We see a lot of car accident patients in our office. Attorneys, insurance companies, judges, you listeners, send us their car accidents all the time because we do a really good job in dealing with car accident patients. If the car was damaged, you were damaged 100% of the time. So please send those folks to us. If it's not you, if it's somebody you know, get them to us right away. Because something as simple as a brain damage or concussion, electromagnetic frequencies can actually make it worse. Chronic fatigue syndrome, autoimmune diseases, bacterial or parasitic infections, Lyme disease, the very young, the very old. Please don't ever have a child use your cell phone next to their ear. Put it on airplane mode. If you have a child, they're going to play with their cell phone, put it on airplane mode, and then they can watch movies or whatever you want to do. But please don't leave it on because the kids' bodies are so much more susceptible to electromagnetic frequencies. It can open up the blood-brain barrier, which is a chemical field essentially around the brain, which can dump toxic chemicals into the body. So it's not hard to do. It's easy when it comes to electromagnetic frequencies. And some people, again, are more susceptible than others, but everybody's going to have a reaction. So once again, to recap, cell phones, keep them away from your heart, keep them away from your genitals, keep them far away when you're sleeping, shut off your Wi-Fi at night if you can, use corded headsets or speakerphone. Make sure you're getting the right nutrients to help build up the antioxidants in the body. Dr. Joe's Super Greens, Dr. Joe's Essential Source, fruits, vegetables, nuts, and seeds. Excellent sources of antioxidants. If you have digestive issues, we may have to adjust your stomach, or you can take Dr. Joe's digestive enzymes as well, and that helps break down your food, which helps reduce free radical production. And if you want to come see us as a patient, if you have neck pain, back pain, shoulder pain, you've ever been in a car accident, traumatic brain injury, come see us. Go to my website, drjoe.com. We're more than happy to set you up an appointment. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We work very closely with all the insurance companies. We try to match your benefits the best we possibly can, because my team of doctors and I have one goal. We want to naturally get you well and keep you well. Folks, I'm Dr. Joe Esposito. Thanks for tuning in. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.